Okay, Dr. Rafich here from Vet Triage. We are continuing on. JAVMA, January 15, 2015. This one is going to be Pathology in Practice. Let's get into it. 3-year-old spayed female mixed breed dog, brittle nails in all 4 limbs, being treated with cepodoxime proxatil, which did not work. Nails were misshapen, broken. So they performed an amputation of a single claw and submitted for biopsy. So, this is a close-up of the messed up nails. You can see it in the picture anyway. This study comes out of the vet school in Illinois. And for those who care about the cells, that's what we're looking at here. The top picture shows that there's inflammatory infiltrate at the dermo-epidermal junction. And then for the lower picture, the interface has dermatitis with loss of a distinct dermal-epidermal junction with pigmentary incontinence. So those are the cells. Histologic findings. The interface of the claw bed epithelium and dermis was multifocally obscured by moderate amounts of lymphocytes and macrophages with fewer plasma cells. There was vacuolation of the basal keratinocytes of the claw bed epithelium and rare basal keratinocyte apoptosis, moderate pigmentary incontinence. The morphologic diagnosis was locally extensive, moderate lymphohistiocytic and plasmacytic interface dermatitis with basal cell degeneration, basal cell apoptosis, and pigmentary incontinence, consistent with lupoid onychitis, also known as symmetric lupoid onychodystrophy of the claw bed epithelium. Case summary: symmetric lupoid onychodystrophy in a dog. Comments: diseases that can affect the claws of dogs include bacterial parenchyma, onychomycosis, so bacterial infection, fungal infection, symmetric lupoid onychodystrophy, nail bed keratocanthoma, nail bed epithelial inclusion cyst, and claw bed squamous cell carcinoma. Other diseases may involve the claw bed. In addition, diseases not limited to the claw bed, like vasculitis or systemic lupus erythematosus, hepatocutaneous syndrome, pemphigus vulgaris, and bullous pemphigoid, are reported to affect the claw beds. However, other cutaneous lesions are expected to develop in animals with those diseases. Symmetric lupoid onychodystrophy is an uncommon disease. Large breed dogs like German Shepherds and Rottweilers are increased risk. Young to middle-aged adult dogs are affected by the syndrome. Sequence-based genotyping of dogs using their leukocyte antigen class 2 in 196 Gordon setters, 98 with symmetric lupoid onychodystrophy, 10 bearded collies, and 110 giant schnauzers revealed a risk haplotype. And I'm just going to list off the genetics here, but it's not going to mean much to most people. DRB1 *01801 /DQA1 *00101 DQB1 *00802, and they also found a protective haplotype DRB1 *01301 DQA1 *00301 DQB1 *00501. And they support symmetric lupoid onychodystrophy as an immune-mediated disease, but allergic, infectious, and immune-mediated diseases have been associated with systemic lupoid onychodystrophy. Some authors believe that histologic changes associated with symmetric lupoid onychodystrophy are a reaction pattern rather than a separate disease entity. In dogs with symmetric lupoid onychodystrophy, there is a separation of the claw from the claw bed of several digits. Subsequent to the separation, sloughing of the claw can occur. Within 2 to 3 months, all claws may become affected. Claws will regrow, although appearing grossly misshapen, and will be characterized by dryness and brittleness and crumbling. Hemorrhage at the sites of sloughing is an inconsistent feature. Lameness and pain can be seen. Definitive diagnosis of symmetric lupoid onychodystrophy is obtained from biopsy results of the claw bed. Interface dermatitis comprised predominantly of lymphocytes, both T and B cells, and lesser numbers of macrophages is the hallmark feature. Apoptosis and vacuolation of the basal cells are commonly observed, and there is pigmentary incontinence. Because there is damage of the dermal epidermal junction, you have to have biopsy of artifactual dermal epidermal separation that can occur during processing. So they're saying that you're looking for that separation, but it also can occur artificially with how you collect the biopsy sample. Optimal biopsy specimens are obtained by means of amputation of the distal aspect of the phalanx, which is best performed on an affected non-weight-bearing digit or hallux, which is the dew claw. A sloughed claw does not usually contain the claw bed, and submission of such a sample is rarely a benefit in cases of symmetric lupoid onychodystrophy. However, a sloughed claw may be valuable for a diagnosis of fungal or bacterial infection via culture. There's a newer technique described where you use a biopsy punch to obtain a sample that includes some of the distal phalanx. This technique collects only a small portion of the lateral claw matrix, and localized abnormalities may be missed, requiring digit amputation. An experience with the new technique may provide a sample of poor diagnostic quality and a misdiagnosis. As far as treatment goes, tetracycline or Doxycycline in the video. I don't know why it's so frozen, but anyway, do the best we can, and I'll see you guys in the next video. Take care.